I am an emergency doctor, and I have seen how powerful good CPR can be. It genuinely saves lives. In this video, I will walk you through simple, life-saving steps you can use if someone collapses. This is for education only and does not replace a certified CPR course, but it can help you feel more prepared in an emergency. First, what exactly is cardiac arrest? Cardiac arrest means the heart suddenly stops pumping effectively. Blood flow to the brain and organs stops. The person becomes unresponsive and stops breathing normally. Without immediate CPR and defibrillation, brain damage can start within minutes. People often confuse a heart attack with cardiac arrest. A heart attack is a circulation problem, a blocked artery feeding the heart muscle. Cardiac arrest is an electrical problem. The heart stops beating properly. A heart attack can lead to cardiac arrest. CPR is for cardiac arrest, when the person is unresponsive and not breathing normally. Step 1. Check for safety. Quickly look around. Is there traffic, fire, electricity, or anything that could put you in danger? Do not become a second victim. If it's safe, then go to the person. Step 2. Check response. Tap their shoulders firmly and shout, "Are you okay?" Look for any purposeful movement, groaning, or signs they're waking up. If there's no response, move straight on. Step 3. Check breathing. Tilt their head slightly back, lift the chin, and look at the chest for about 10 seconds. Are they breathing normally or just gasping occasionally? Gasping, snoring, or no breathing at all should be treated as not breathing. If they're unresponsive and not breathing normally, this is a cardiac arrest until proven otherwise. Call your local emergency number immediately, or shout for someone else to call. Put the phone on speaker so you can start CPR while talking to the dispatcher. Many dispatchers can coach you through CPR in real time. If someone else is nearby, ask them to look for an AED, an automated external defibrillator. These are often found in airports, malls, gyms, and offices. Tell them, "Bring it here and turn it on." The device gives voice instructions and is designed for the public to use. Now start chest compressions. Lay the person flat on their back on a firm surface. Kneel beside their chest. Place the heel of one hand in the center of the chest, on the lower half of the breastbone, between the nipples. Place your other hand on top and interlock your fingers. Keep your arms straight, lock your elbows, and position your shoulders directly above your hands. This lets you use your body weight, not just your arm muscles. Keep your fingers off the ribs so the pressure goes straight down onto the sternum. Push hard and fast. For an adult, aim for a depth of about 5 to 6 centimeters, roughly 2 inches, at a rate of 100 to 120 compressions per minute. A simple guide is the beat of the song "Stayin' Alive." Let your hands come all the way back up after each compression so the chest can fully recoil. If you're not trained, or you're not comfortable giving rescue breaths, do hands-only CPR. Continuous chest compressions without stopping. Push hard, push fast, and don't pause unless the person starts moving and breathing normally, or professional help takes over, or you are physically unable to continue. If you are trained and willing to give rescue breaths, use a cycle of 30 compressions followed by 2 breaths. After 30 compressions, open the airway by tilting the head back and lifting the chin. Pinch the nose closed, make a tight seal with your mouth over theirs, and give one breath over about 1 second, just enough to see the chest rise. Give a second breath, then go straight back to compressions. When an AED arrives, turn it on immediately and follow the voice prompts. Expose the chest, remove any medication patches, wipe away moisture. Attach the pads exactly as shown in the pictures. One pad on the upper right chest, the other on the lower left side. The AED will analyze the heart rhythm. Make sure no one is touching the person while it analyzes and, if advised, while it delivers a shock. After a shock is delivered, or if no shock is advised, start chest compressions again immediately. Do not waste time checking for a pulse if you're not trained. Follow the AED prompts and keep going with cycles of compressions and breaths if you're giving them, until the person wakes up, moves, or emergency professionals tell you to stop. For children and infants, the principles are the same. Recognize unresponsiveness, call for help, start compressions. But there are some differences. For a child, you often use 1 or 2 hands depending on their size, and compress about 1/3 of the chest depth. For an infant, you use 2 fingers in the center of the chest, or 2 thumbs encircling the chest. For children and infants, rescue breaths are even more important because their cardiac arrest is often caused by breathing problems. Common mistakes include not pushing deep enough, going too slow, leaning on the chest and not allowing it to fully rise, stopping compressions for too long, or being afraid to start at all. Remember, doing something is almost always better than doing nothing. A person in cardiac arrest is already in a life-threatening situation. Your actions can only help. To recap, if someone collapses and isn't breathing normally, check safety, call emergency services, start chest compressions hard and fast in the center of the chest, use an AED as soon as possible, and keep going until help arrives. CPR started early can double or even triple the chance of survival. This video is a guide, but it's not a substitute for hands-on practice. I strongly recommend you take a certified CPR course. It might be the most important skill you ever learn.